This is Reframe, the podcast from the College of Education, Health, and Society on the campus of Miami University. In this episode, we explore new movements to improve public health, literally, as kinesiology and health students get involved in civic engagement to improve the bikeability of their local community. On a normal day in Oxford, Ohio, cyclists cruise throughout the small college community that many call home. Even during the slower summer months, faculty, residents, and even some students will ride to and fro on bike lanes that run straight across town and right through Miami University. Here, as in many communities, a burgeoning bike culture is growing. And though many may not realize it, the bike lanes they use represent far more than just lines running parallel to a few roads. They are, in fact, part of an ongoing base research and community engagement project between the local township, Miami's College of Education, Health, and Society, and its kinesiology and health students.
You know, the history is that to get that bike lane was a big deal. And there were some students involved. We had to make a case that there would be a need for it. So students did some counting. Our students have been involved with tracking usage, and they found that the good news is that the bike lane usage, except for the winter months, it's significant, and actually it's on the rise.
That's Dr. Helaine Alessio, EHS professor of kinesiology and health. If you build it, she says, they will come. If you put bike lanes in, they'll use them. On the surface, these bike lanes were a great resource for bikers and commuters. But below the surface, if we look just a little bit deeper, they also become part of the interconnected cultural and contextual variables that can affect wellness on community-wide levels. Individual diet and exercise, of course, matter, but they're far from the whole story. According to Alessio, the health of a community is highly dependent on the health of the environment, which includes well-known factors such as pollution, but also emerging public health concepts such as active transport and what's now being called the built environment are being closely examined. The built environment refers to human-made spaces and places like parks, sidewalks, gardens, and transportation systems, among others, which can all influence public health. Some communities have more access to such resources, while others don't. Those that do are better able to reap the associated health benefits, and improving a city's bikeability is just one example. Alongside the obvious boost to individual physical fitness, the benefits to biking also ripple outward. Typically, more bike usage means less automobiles, which leads to less road construction, less congestion, less accidents. Economically, research has correlated it with revenue boosts to local businesses, individuals who save on car costs, and even increased property values for homes with easy biking trail access. Environmentally, it also leads to improved air quality through reduced carbon emissions, which Alessio and her students have already studied.
Just in Little Oxford, when we did this count of the average number of bikes, and this was a couple of years ago, the average number of bikes counted with the bike lanes is actually even more now. So we did this prediction of average number of single occupancy vehicle miles replaced by each bike. We're only talking about two, one each way on the bike lane, but it's possible there's more. It could be double that. So I'm just saying we were very, very, very conservative. All right. So it all comes out to saving approximately 4 metric tons of carbon dioxide per year.
That's with just 24 bikes per hour, riding just 2 miles a day instead of driving. And given the moderate nature of this study, the real number is likely far higher, as it would be also in much larger communities with far more traffic. But before this, or any other benefit can take effect, the proper infrastructure has to be in place, as well as the people willing to make it happen. And in Oxford, the bike lanes were only a first step. Carly Geller, EHS Assistant Professor of Health Promotion, also enlisted students to survey nearly 700 bikes secured to various racks around 84 campus buildings. The students assessed the condition of the bikes and looked at which were rideable, which were not, and why.
They're helping to track the data. They're helping to do these calculations. They're helping to verify numbers, and they're thinking of other things like what else might influence people who want to ride a bike? Temperature, whether it's raining, gas prices. Maybe another thing is whether or not there's a bike rack that you can secure a bike to, maybe. Or maybe it's whether your bike is working because it's been out in the rain for 2 weeks and now the chain is rusty. and then on and on and on.
Off campus, this has also led directly to the project's most recent phase, which includes tracking bike rack usage in Oxford's primary business district. And through an interdisciplinary partnership with Miami's College of Creative Arts, plans are in place to install several functional and creative bike rack sculptures around town. Designed by Miami art student David Stelmach, the new bike racks will give cyclists even more accessibility, and so far 3 locations have been identified and 3D models of proposed sculptures have already been created. The Oxford Community Foundation will fund the project, and various local businesses are also tentatively on board. But before the new bike rack sculptures can become a reality, Alessio and her students must once again navigate the world of civic engagement and acquire approval from the City Council. Building codes, available sidewalk space, various engineering logistics, and more must all be considered first.
When they had the discussions at City Council, whether or not to approve the bike lanes, those meetings were packed. And there were some students at those meetings. There were several students at those meetings. And it was a great example of them seeing how grassroots community activism can help to work the way the community wants. You can't just sit back and wait for somebody else to do it. And they learned that. They saw that. And they also saw the pushback. So students learned, like, there's give and take. And then if you want something, you have to document, provide evidence, and make a strong case for it.
So perhaps, maybe even more significant than the practical benefits they're bringing to their college community, maybe the breadth of first-hand experiences these students are acquiring along the way. After graduation, many will pursue various health-related fields, and soon they will have communities of their own to improve as professionals themselves. But until then, they now have the opportunity to explore the multitude of factors that can influence public health, what it takes to introduce even seemingly small and innocuous changes to the built environment, and how it's all connected.
You may not know of it coming in, but then you have to be aware of it. You have to be aware of health from a variety of forces. Like if you think that health is only about going out and jogging and eating right, and that's pretty much it, you don't get it.
And that's because there are so many more things involved, like socioeconomic status, like ethnicity, and clearly where you live.